24-year-old woman visits your outpatient clinic with low-grade fever, fatigue, joint pain, and a facial rash that worsens whenever she goes out in the sun. Over the next few months, she develops hair loss, mouth ulcers, anemia, proteinuria, and even seizures. At first glance, these symptoms appear unrelated. She consults a dermatologist for the rash, an orthopedic surgeon for joint pain, a nephrologist for kidney disease, a neurologist for seizures, and finally a psychiatrist for depression. Every specialist treats one organ, but no one connects the dots. Eventually, she is diagnosed with a single disease, Systemic Lupus Erythematosus, or SLE. This is why SLE is often called the Great Imitator. It can involve almost every organ system, making diagnosis one of the greatest challenges in clinical medicine. In today's masterclass, we'll understand not only how to diagnose SLE, but also why it behaves the way it does, from molecular immunology to bedside management. What is systemic lupus erythematosus? Systemic lupus erythematosus is a chronic, multi-system autoimmune disease characterized by loss of immune tolerance to self-antigens, production of multiple autoantibodies, formation of immune complexes, complement activation, persistent inflammation, progressive damage to multiple organs. Why is SLE called the Great Imitator? One patient may present with fever, fatigue, arthritis, hair loss. Another may present with stroke, deep vein thrombosis, recurrent miscarriages. Another patient may initially have proteinuria, hypertension, renal failure. Yet another may present with psychosis, seizures, cognitive dysfunction. Although these patients appear to have entirely different diseases, all of them may actually have SLE. This remarkable variability is why SLE is called the Great Imitator. Clinical Pearl. Think of SLE whenever a young woman has unexplained symptoms involving two or more organ systems. For example, arthritis plus rash, rash plus kidney disease, hair loss plus anemia, mouth ulcers plus thrombocytopenia, photosensitivity plus proteinuria. This pattern recognition is often the first step toward diagnosis. The burden of disease SLE predominantly affects women of reproductive age, 15 to 45 years, female to male ratio approximately 9:1 before menopause, with variation across populations and disease onset age, higher prevalence and often greater severity among individuals of African, Hispanic, Asian, and indigenous ancestry. Although women are affected far more commonly, SLE can also occur in men, children, and older adults. Historical perspective. The word lupus comes from the Latin word for wolf. Early physicians believed that the facial rash resembled the bite marks of a wolf. The word systemic was added later when physicians recognized that the disease extends far beyond the skin to involve multiple organs. Now that we understand why systemic lupus erythematosus is called the Great Imitator, the next logical question is, why does the immune system begin attacking its own body? To answer that, we must journey into the fascinating world of immunology, where genetics, environmental triggers, defective apoptosis, NEToses, autoantibodies, and complement activation come together to produce one of the most complex autoimmune diseases in medicine. In the next chapter, we will explore the etiology and immunopathogenesis of SLE, building the foundation needed to understand every clinical feature and every treatment strategy that follows.